Hello. Welcome back to Medilab Health. In today's video we are going to talk about simple blood test known as ESR test. The term ESR stands for erythrocyte sedimentation rate. Erythrocytes are the red blood cell in your body. ESR test measures the rate at which red blood cells settle to the bottom of a tube in a period of 1 hour. You can have a ESR blood test if you have any signs of inflammation or infection. ESR test is not specific for one disease, but is used in combination with other tests to determine the presence of increased inflammatory activity. For the ESR test, blood is typically collected to 3.8% sodium citrate anticoagulant tubes. Then this blood is transferred to a vertical tube known as Westergren tube and allowed to stand for 1 hour, and the red blood cells will slowly fall to the bottom due to the influence of gravity. The red blood cells sediment because their density is greater than that of plasma. In normal conditions, the red blood cells are negatively charged and therefore repel each other rather than stacking. When there is an alteration in the distribution of charges on the surface of the RBC, resulting in their coming together to form large aggregates known as rouleaux. Rouleau formation is determined largely by increased levels of plasma fibrinogen and globulins. So, the ESR reflects mainly changes in the plasma proteins that accompany acute and chronic infections, some tumors and degenerative diseases. Average values in healthy men are less than 15 mm per hour, and in healthy females, they are somewhat higher, less than 20 mm per hour. The values are slightly higher in old age, in both genders. Abnormally high fibrinogen levels and C-reactive proteins may occur as part of the body's normal response to an infection or inflammation. These proteins are positively charged and it increase the stacking of red cells. Non-inflammatory conditions that can cause raised ESR include anemia, kidney failure, obesity, aging, and female sex. Elevated ESR is experienced in cancer conditions such as multiple myeloma and lymphomas. ESR is also higher in women during menstruation and pregnancy. Polycythemia, a condition of increased number of red blood cells, causes reduced ESR as blood viscosity increases. Hemoglobinopathy such as sickle cell disease can have low ESR due to an improper shape of red blood cells that impairs stacking. In myocardial infarction, rheumatoid arthritis, ESR become low. Thanks for watching this video. Make sure to subscribe and share with your friends.